one of our strengths is that our faculty are actually quite diverse in terms of their backgrounds and where they trained. We're not a program where everyone came through Northwestern or one certain institution. We really have pulled faculty from all the top programs in the country. So the fellow gets to learn from lots of different angles and experiences. Hi, I'm Vineeta Swaroop. I am the director of the Lurie Children's Pediatric Orthopedic Surgery Fellowship. Lurie Children's is always consistently among the top-ranked pediatric hospitals in U.S. News & World Report, and it is the #1 children's hospital in the state of Illinois. We are uniquely situated in that we have a big city population to draw from, and we're really the premier pediatric orthopedic surgery program in the city. We're the only program with a fellow. And so our tertiary volumes reflect a broad variety of patient pathology. We have upwards of 20 programs ranging from cerebral palsy. We have one of the largest spina bifida clinics in the country to hip preservation, scoliosis, complex spine, trauma, hand and upper extremity, brachial plexus. Luckily here we have pretty much every aspect of pediatric orthopedic surgery covered, and the fellow gets to experience all of that. While we have only one fellowship spot, we have a very high volume for that fellow to choose from and tailor to whatever they want most to get out of it. We do over 41,000 clinic visits annually, about 1,700 surgeries annually, and the fellow really has to choose for him or herself what of that they would like to take advantage of. There are 6 rotations of 2 months each. The last of those rotations is an elective. It's strategically placed at the end of the year so that ideally by then the fellow knows where they're going to end up and what they're really going to focus on in their career. And so they can use that elective to gain a little bit more experience in that area, or if they have a special niche interest in something unique, they can really tailor those 2 months to that. We do have an expectation that the fellow will complete a publication quality project by the time they're finished, and we have tons of support to help the fellow do that. We have a research manager who is excellent. We have 3 full-time research coordinators. We have access to biostatistics help, and our program is fairly research productive. We average about 15 publications a year out of our faculty. So there are projects which are already in place. We have lots of support for the fellow to develop a new project, and basically anything the fellow is interested in, we can help make happen. So we are looking for someone who is motivated and driven to get the most out of their year and learn the most about pediatric orthopedic surgery as they can. We are a relatively new or young fellowship program, but the advantage that gives the fellow is that we all have our clinical structure in place. We don't need a fellow to help run our practices. We have a fellowship because we truly believe that we can offer the fellow a wonderful educational experience. Our whole goal and focus is on making the year the best for the fellow. You're not coming to help us do our work. We're trying to give you the best experience possible. Thank you for your interest in our program. We're excited to help you learn more about it. And if you have any questions, please feel free to reach out. We're happy to answer anything.